Hi guys, so welcome to our another gross anatomy lecture series for the abdomen. Today we're going to talk about the rectus sheath. In one of our previous videos, we spoke of the rectus abdominis. We also spoke of the pyramidalis muscle, and we said these muscles they are found in the rectus sheath. So what is the rectus sheath? What does it contain? Let's find out. Right. So right here, this is your rectus abdominis muscle. So we are going to have two cross section. So we're going to see the cross section at this point A and compare the cross section at this point B. Right, good. So take note of this. Before we take these cross sections, the rectus sheath, right, does not completely enclose the rectus sheath, the rectus abdominis. So it does not completely enclose it, right? As much as it encloses the rectus abdominis muscle, but it does not completely encloses the rectus abdominis muscle. So let's take a look. What forms the rectus sheath? Right, so here, this is the transection or the transverse section at level A. So you're going to have those three muscles, your external oblique, your internal oblique, your transversus abdominis. Right. At the mid-clavicular plane, these muscles, they are going to change from muscles to aponeurosis. So they are going to send aponeurosis. Right. So let's start with the median oblique. When the median oblique muscle reaches the mid-clavicular line, it becomes an aponeurosis. As it becomes an aponeurosis, it's going to divide, enclosing the rectus abdominis muscle, forming two lamina, an anterior lamina and a posterior lamina. Right. So the anterior lamina of the internal oblique and the aponeurosis of the external oblique are going to form the posterior wall of the rectus sheath. Good. Then the posterior lamina of the internal oblique, together with the aponeurosis of the transversus abdominis, are going to form your posterior wall of your rectus sheath. And these walls, they are going to join in the median plane to form a thickening called the linea alba. So this is your linea alba. Your linea alba, it expands from the zyphisis pubis, from the xiphoid process to the zyphisis pubis. Xiphoid process to the zyphisis pubis. You understand? And as it moves from upward to downward, it will be narrowing down. It will be narrowing down. Good. So that forms the rectus abdominis sheath. So a question can come and say, the internal oblique forms the posterior wall of the rectus sheath. True or false? That is true, because it forms the posterior as well as the anterior wall of the rectus sheath. Good. Right. So what is found in the rectus sheath? Before I go there, I want you to see the rectus sheath. Actually, its orientation differs depending on the region of the transverse section. If we go at this region B, at the level of the superior iliac spine, you're going to actually see we are going to have something like this. You have your rectus sheath only in the anterior wall, but it will be absent in the posterior wall. So the anterior wall of the rectus sheath is going to be formed by the aponeurosis of the external oblique, internal oblique, and the aponeurosis of the transversus abdominis. they are going to form the anterior wall of the rectus sheath. But in the posterior, there is no, you're not going to find the rectus sheath wall, but rather you're going to have the transversalis abdominis muscle. So this is a transversalis abdominis muscle. You understand? Good. So remember, I said the rectus abdominis, the rectus sheath does not completely enclose the rectus abdominis. So at the level of the superior iliac spine, you are not going to have the rectus sheath in the posterior portion of the rectus abdominis. Understood? Right. Let's take a look. What about above the costal margin? Want to have a transection right here at this point and see how does it look like. Let's take a look. Now we are now looking the rectus sheath above the costal margin, right? This is at the level between the costal margin and the superior iliac spine. This is at the level below the superior iliac spine. So we spoke of this one and we also spoke of this one. Let's take a look at this one. So remember the rectus sheath has an anterior wall and a posterior wall. At this level, the anterior wall is made by the external oblique and the internal oblique, and the posterior wall by the transversus abdominis aponeurosis and the internal oblique aponeurosis, right? And then at this region, we only have the anterior wall, we don't have the posterior wall, because in the posterior wall, we have the fascia transversalis. You understand? But all the aponeurosis, they will fuse and join the anterior wall at this level. But at the level above the costal margin, right, the anterior wall is only going to be made from the external oblique aponeurosis. Why? Because the internal oblique and the transverse aponeurosis, they originated below the costal margin. So if we extend above the costal margin, we are going to see the aponeurosis of the external oblique. So in the anterior wall of the rectus sheath, you're going to have the external oblique. And then in the posterior wall, you're only going to have the intercostal cartilages of rib number 7, of rib number 5 to rib number 7, and the xiphoid process. Rib number 5 to rib number 7, and the xiphoid process only, right? So I think now it now makes sense. Above the costal margin, below the costal margin, the superior iliac spine. You understand now? Good. So you need to get this orientation. What is found in the rectus sheath? Let's take a look. Right, so first you're going to have the rectus abdominis muscle here together with the pyramidalis muscle. And then you're going to have the superior epigastric and the inferior epigastric muscles. They will be deep to all these muscles, right? As the anastomose about the umbilical region, right? And also you're going to have the thoraco-abdominal nerves. There are thoraco-abdominal nerves. You can actually see these nerves, right? Which is T7 to T12. T7 to T12. You are not going to find any iliohypogastric nerve. The iliohypogastric nerve and the ilioinguinal nerve, they are not contents of the rectus sheath. They are not contents of the rectus sheath. You're also going to have some lymphatics as well as veins, right, within this rectus sheath. So the following are the contents of the rectus sheath. 1. Rectus abdominis muscle. 2. Pyramidalis muscle. 3. Thoraco-abdominal nerve, T7 to T12. 4. Lymphatics. 5. The superior epigastric artery, anastomosing with the inferior epigastric artery. 6. Lymphatics. Those are the contents of the rectus sheath. So thank you so much, guys, for listening to today's lecture. Thank you so much. See you next time.